Good afternoon, everyone. Thanks for joining us on the news briefing for this Wednesday. We'll go ahead and get started. We have Christy Mishi, who is the Assistant Director of Public Health, joining us today. If you've got questions for Christy, go ahead and begin putting your questions in the chat, but we'll get started with an overview. Good afternoon, Christy.
Good afternoon, everyone. Thank you for having me again today and allowing me to fill in for Dr. Moreno. Just want to start out by just a brief overview of where we are in Monterey County right now. And really, I have the unfortunate task of pointing out that we've reached a new all-time high case rate for the pandemic recently here in Monterey County. Our current case rate is at 108.6 per 100,000 population. And that exceeds our prior known high case rate of 107.8, which we reached back in January, on January 9th of 2021. So I think this really reflects how prevalent COVID-19 is in our communities right now, how efficient the Omicron virus is transmitting among our population. Our test positivity is at about 19.3%. So that means that for every 100 people tested, about 19 people on average are testing positive. We have 103 people currently hospitalized who have tested positive for COVID-19. The good news is that while our case rates are at record high levels, our hospitalizations are really only at about half of where they were during last winter's surge. So that's really great news. And our deaths are less than a quarter of where we were last winter during the surge. So that really, points to several factors. Folks that have done a great job of getting vaccinated. We have 81% of our population that's eligible to receive a vaccine have received at least one dose. And, we keep making progress all the time on vaccination. We've had lots of booster uptake, particularly in our age groups of 50 years and older. So right now, I think that, it's really important that people continue to move forward with all these measures that we've taken over the past 2 years to protect ourselves and our families, like getting vaccinated, getting our boosters, wearing our face coverings, staying home when we're sick, and of course, getting tested. And I know we're going to talk about testing later on today. So I think, Maya, with that, I'll take any questions.
Thanks very much. And thanks for giving us an overview on that. So I do have a couple of questions for you. And one of them just is a follow-up to just what you just spoke about. Monterey County has a current case rate of 98 with 103 hospitalizations. How concerning is this? And I know you talked a little bit about it, but maybe you could talk a little more to it.
Right. So as I mentioned, this is an all-time high for us, or an all-time low, whichever way you want to look at it. But it does point out the need for us to continue to move forward with preventive measures, to move forward with wearing face coverings and staying home when we're sick. I know that it's been a long pandemic and folks really want to return to more of a more normal situation. But, for the next few weeks, it's very important that we all continue to do our best to implement preventative measures.
Thank you for that. And another question, what more can be done to stem the tide of cases and hospitalizations? Has the COVID-19 Omicron variant crested yet? And how long before we could see these numbers come down?
Boy, I wish I had a crystal ball to predict things. But unfortunately, I don't think we've hit the crest yet. I think we have a little bit ways to go. We haven't seen locally our numbers slowing down. So I think that they are increasing. If we look at what happened in New York and some other places, we think we'll be at pretty high levels here in Monterey County for the next couple of weeks. So it's really important that again, we all practice those preventive measures to control COVID-19 that we've become accustomed to over the last 2 years. In terms of what we can do to stem the tide of hospitalizations, really the singular most important thing people can do is to get vaccinated if you haven't already. It's not too late. Please, if you haven't gotten vaccinated, consider doing so now. If you have been fully vaccinated, so you've completed your primary series but haven't gotten your booster, now's a great time to get that as well. There are plenty of places where you can get free vaccinations. Our website has a list that you can refer to. Many pharmacies have vaccines, so there's lots of opportunities to get vaccinated. And I think that really will help. Vaccines have been proven to reduce hospitalizations and deaths. So that's the number one most important thing we can do right now.
Thank you. And one more question, given the current number of hospitalizations, are there concerns about hospital capacity as we near the crest of this surge?
Well, I really think that's a question for the hospitals to address. They know best their capacity, but everything we can do as a community to help that situation, like wearing our face coverings in public and getting vaccinated, will go a long way, I think, to support them and make sure that we don't overwhelm the healthcare system.
Thank you. And I did get a question that I came in by email and not necessarily in chat, but I'm going to go ahead and ask it anyway. We got some great news last week that some long-awaited rapid tests had come into the county, and there was some questions about how those are distributed. And when you hear that many tests come in, you think, oh, there's one for me too, but there are some very strict guidelines as to how those tests will be distributed.
Sure. So those tests came in from the California Department of Public Health with some stipulations to them that they go for some certain purposes. And those primarily are to make sure that we are returning healthcare professionals back to the workplace as quickly as we can, that we're controlling outbreaks, that we're making sure school children and teachers can stay in the classroom, and then, of course, to help support community testing. But really our primary concern right now is making sure that our healthcare workforce can stay on the job and return to the jobs as quickly as possible. So how the process for distributing those test kits works is that agencies submit requests through the medical health operational area for kits. And as you might expect, that process received requests for many more kits than we actually received. We received thousands of times over requests for the number of kits that were had. So we did our best to divide up those test kits among the agencies that had requested them, and they'll be receiving notifications of when and where they can pick up the kits to use for those purposes that I mentioned.
Thank you very much for that explanation. I think I have another question. I think you mentioned this earlier in another question, but if you could just answer this one, when are we expecting the peak of the pandemic? I know you gave an estimate, but it was wrapped up in another answer.
Sure, so we really don't know for sure because this is our first Omicron surge, but I would expect here in Monterey County, we're going to see cases remain high for the next couple of weeks.
All right, I have no other questions for you in chat. Are there any other questions for Christy before we let her go for the day? Seeing none, thank you, Christy, very much for joining us on the briefing and giving us an update today.
You're welcome.
All right, now we're going to move on to the testing discussion that Christy alluded to. For those who need a rapid COVID test, these have been some trying times. There has been a shortage, but we have Kim Stemler, who is here to explain how to navigate the current situation and to where to get a test and how to find a test that's near you.
Thank you, Maya. Hi, everyone. It's really difficult to find tests right now. There's our supply chain issues due to increased demands. We've never seen lines like this at testing sites. And testing staff are also getting sick, like many others in the community. So what we recommend is go to MontereyCountyVaccines.com. It has a list of vaccination and testing sites, clinics, really, the clinics that are available publicly. And what we do, because every day we hear something new, at the top of each page of the website, there are updates to all of the lists. So if we learn that a clinic is going to close that's on the weekly list, we'll put it in red at the top of the website. So please, if you can share that people go to this website, use this website. It's going to be the most up-to-date, more up-to-date than the flyers we distribute regularly. And one of the problems we've had is because particularly with the VITA project and other projects that are programs that are offering rapid tests. In order for somebody to actually get physical results, so a piece of paper they can hand out, we need to input all of the results into the system. That is being changed for the VITA project. You'll still get something either emailed or text, but starting this week, we're actually going to have forms available. So if people just wait around for 15 minutes, get the results of their test, we can write it down in a form that is pretty much identical to the one that they're going to have emailed or a text to them. So they'll be able to bring it to their school or bring it to their employers or whoever else needs proof that hopefully they're negative. So look for that coming. I think that will make a huge shift in a lot of people's lives. And that's it. I'm open to any questions. It's just hard. People have been so patient in the lines, and we really appreciate that. It's just hard all around.
Can you also talk a little bit about you? I know that you're updating daily, and I think a lot of people either go to the website or they look on social media for notices for when there are pop-up clinics. The time in advance of when those pop-up clinics are being announced, pretty short right now. Can you maybe talk a little bit about maybe a little patience? You got to keep looking a little bit if that's what's important.
Yeah, the system is stressed. Know that everybody's doing the best they can, and the system is stressed. So really, you need to check every day, check social media, learn who your reliable channels are. And one is the county. Another on social media is the VITA project. And there are several others that are posting reliable information, up-to-date information every day. And that's what it takes. We're all in this together, and Monterey County has done a tremendous job at working together. I don't know any other county that has come together in the way we have, private, public, government. We just done a great job. And regular community members, wonderful community members need to have a part in this too. They need to take responsibility. And unfortunately, their responsibility is to monitor social media, to look things up on the website.
And a little patience.
And people have been so patient in the lines and really gracious. We know there are long lines. So we appreciate everybody's graciousness.
All right. Does anyone have any questions for Kim? Kim, I really appreciate you just kind of updating us on where that is at. I think that website is just really has become an essential, stopping point for information, and to know to check it daily is just really helpful. That way everybody just can put it in their schedule if that's what they need.
That's great. Thank you so much, Maya. Thanks, everybody. We really appreciate you.
Thank you, Kim. And so now let's move on to the book you might be bringing. You might be reading on your phone while you're reading in line for your tests. Our Monterey County Free Libraries have gone fine-free, and our library director, Hillary Thayer, is here to explain how that is possible.
Thank you. And thank you for inviting me here today. This is a piece of news we were thrilled about in the fall, and we have implemented it now. All of our branches of the Monterey County Free Library System are no longer charging overdue fines. So your books will still have due dates, and they're still going to go overdue. So you're still going to get overdue notices, but no more will we charge that 25 cents a day penalty just for keeping the item late. We want to encourage you to bring them back and renew them, but no more overdue fines. What will happen is if a book or an item does not come back, eventually it would be marked lost. And at that point, you would get a bill for the item. You could still bring it back at that point. So this is all 16 branches of our Monterey County Free Libraries and our 3 bookmobiles. This includes our service library by mail as well. And I'm putting in the chat a little link to a fun video our staff made. We have a series of videos on our YouTube channel called Monty and Barry, and it's our mascot and a bear puppet. And all they do is get together and tell corny jokes. It's one of those fun things if you have 4 or 5 minutes in the middle of a day and just want to have some fun, watch one of our Monty and Barry videos. And just today we posted, in honor of going fine-free, some corny library jokes. So I put the link in the chat if you want to watch some Monty and Barry. The second piece of news I did want to share is we have a new 1-800 number for your library. 1-800-322-6884. And we implemented an 800 number after the pandemic started, and we started really serving people a lot by telephone. We realized how many people to dial their local branch from their landline had to pay a toll, because this county is just that big that often their nearest branch was pretty far away. So we implemented an 800 number. It leads to a bilingual phone tree that from which you can reach any of the branch libraries and any of our offices at our administrative office. For example, to reach a branch in English is 2 pushes. In Spanish, it's 3. So it's not a huge, long, complicated type in the name phone tree. It's really easy. And you can reach them all through this 1-800 number we have put on our website. I will also type it into the chat. So for anybody using a landline to reach their library who's getting charged a toll, please spread the word about our 800 number as an alternative. You can also still direct dial any of our branches. And those are our big pieces of news. And thank you for inviting me to share them today, Maya.
Well, and I can do my review of Monty and Barry as doing excellent dad jokes. So anyone who's a fan of the horrid dad joke, Monty and Barry have what you need.
Yes, and I say adults, kids, families. I sometimes watch them just to have a 3-minute smile in the middle of my workday. I'll check out what Monty and Barry are telling each other today.
Thank you. And any questions for Hillary? And thanks very much for talking about the 1-800, the 800 line. And I think people aren't aware of that, what people go through to call the library, and how the pandemic changed a lot of things. Maybe people went more online, but they also wanted connections.
It really was revealing how many people would get in their car to ask a question that we could help them over the phone. They would come in, and then once they weren't able to come in, it really exposed some of these needs, and we're happy to just piece away and solve them one by one. And I'm really happy that we're able to offer a completely toll-free way to get to any of your branches via a landline telephone or a cell phone. You can use it on the cell phone too, but the tolls were being charged to landlines.
Thanks very much. And thanks for sharing the information. And so we'll see you next time. And then we were going to end it right there, but we were very fortunate to have someone from our animal services to be available to come on the news briefing today. So we've got Kendra Brady. She's the educator and volunteer coordinator at Animal Services. And a lot of you know that it was Betty White's birthday on Monday, and there was a Betty White challenge that I'm sure Betty was just sitting up on a cloud somewhere saying, yes, this is what I want. And it was a challenge to show your support for rescues and shelters around the nation. And boy, people came through. And Kendra, tell us what happened at Animal Services on Monday.
It's been exciting to see over 30 deliveries coming into the shelter. We've had cat food, the dry stuff, the canned stuff. We've had cat toys. It's the little mama's heart when we get our neonate kittens. It sounds like a mama's heartbeat, so we'll tuck those in with little kittens. We've gotten martingale collars for our dogs, and the leads and the leashes that we need, and we've gotten the Adopt Me harnesses, because we're all about advertising, who needs out, all kinds of dog toys and dog food, and it's just wonderful to see the community come together like that. When Betty White passed, she had such a passion for animals. It just seemed so fitting to put this challenge together in our community again, because of COVID has really, I think they've done so much more because they want to feel like they're participating. So it's been fun to see, our Amazon wish list getting filled. We've had our Amazon gift cards come in. We've had people walk up to the door and they're like, this is for Betty White, so they're just excited. We're excited. It, warms our heart. They're really good about looking at our social media and our website to see what we're working on. So talk about answering the call. They did a great job.
Thank you. And then Kendra, I know you're the volunteer coordinator, and I'm going to hit you with a surprise question. If people want to be a volunteer, what is the process for volunteering, and what does a volunteer do with the shelter?
Well, we've changed our process just a little bit. And so contact first is, to me with a volunteer interest form, which is on our website. And at that point, I contact them, I send them an informational orientation video with instruction for what the next steps are, which would then be to schedule their live scan for fingerprinting. Once that's cleared, then we get them onboarded with the county, and they go in for their TB testing, and they come in for training with me. So we have dog walkers, we have cat room cleaners, we have people who come in and feed the dogs in the morning or in the afternoon. We've got cat socializers, dog socializers. Particularly what a cat socializer does is we're going to be coming up on KITTEN season. We don't say that word out loud. But when we get those little ones without their moms, they don't know how to trust people. So we have adults who come in and work with them and teach them how to play and how to track and how to not bite. It's wonderful. The volunteers provide so much more. I tell them, you're not just a dog walker. They're looking for behavioral things. They're looking for physical things that sometimes they're the first eyes on it. So they have a huge responsibility here, but they love it. They thrive. We're always looking for more volunteers. We have wonderful animals here. Keep taking a look, sharing our Facebook pages really helps us so much, especially the stray reports, because that's how we get people to see, oh, my dog's at the shelter. So it's been hugely successful getting the stray post out. Our return to owner has definitely increased.
So if people would like to volunteer, they should go to the website and look for the application form?
Yes, it's a volunteer interest form. And then I send them the link for the, actually through DocuSign, I'll send them a volunteer application. Then I send them the video, and it's a little more streamlined. And we've had a great response. I know live scan's a little backed up, so that's been an issue for me, but we'll get through this.
All right. Thanks very much, Kendra. It's really great to end on a high note. So much good news. So much good news at the shelter.
I almost brought a kitten in to have it sit on my shoulder, but
Well, we'll have to have a discussion about why there wasn't one there later.
I saw Kim had one in her. She had a dog walking through her room, so so funny.
Thank you, Kendra, and thanks thank you, Kim, for bringing the dog. Thanks for joining us on the briefing this week. Our next briefing is next week. We'll see you then.